For our company, we think of the supply chain as the entire process of where that raw material comes from to get all the way through our manufacturing process and all the way to our customer. That's the supply chain for us, and that includes every person that touches that product.
Prior to the inception of the Business Leadership Coalition and the Greening the Supply Chain initiative, it was very rare that two or more group purchasing organizations or hospital systems got together and talked about purchasing and what questions ought to be in their RFPs and so forth. Our thinking was that we ought to have hospital systems and we ought to have all the GPOs that we work with, and we ought to have companies all in the same room having real conversation about how we could increase the purchase of environmentally preferable products.
Sustainability is not a one-task operation. It's multifaceted. There are a lot of aspects to sustainability that we need to focus on. I don't think that suppliers can solve these problems by themselves. Healthcare can't solve it by itself. GPOs can't solve it by itself. Government is not the solution. We all have to work together, and the Business Leadership Coalition really brings the voices together.
I think it's important when you think about our overall mission, which is first to do no harm. We need to really look at what are the products and services that we're buying doing to our patients as well as the environment.
One of the most important tools that Practice Green Health has provided is the standardized questions for sustainability for medical devices. To bring a standardized approach to the questions that are asked has really helped us understand what's important to our customers and how we can set our sustainability strategies to meet some of those important drivers.
There's a ton of data on the Practice Green Health website that shows what's available, what questions to ask based on contract portfolio, which is often a challenge in some large healthcare facilities because the folks that are doing the contracting and the value analysis don't often know the right questions to ask. So those are great tools for us to take back to our contracting department to be able to have them utilize in their day-to-day work to start that discussion about really what is environmentally preferred purchasing.
Our Business Leadership Coalition through Practice Green Health has really looked at how we can bring a greater understanding of the cost of materials, because cost is so important and often it's seen as the barrier to making choices regarding making environmentally preferable purchasing decisions. Some of the tools that we're working on right now with Practice Green Health have to do with helping people understand that total cost of ownership, understanding what the beginning of that cost is, acknowledging that price, but really looking at what the net effect is over time when using that product, because that's really the cost. And it may not affect that purchaser at that moment, but it certainly affects the facility that they represent.
I would tell other businesses who are looking to engage with others in the supply chain on this issue that it provides a forum for companies to come together, to pool our expertise and help make strides to make sure that we have better environmental considerations throughout the supply chain.